My name's Frida. I'm a sexual health educator at the Young Women's Resource Center. And today we're going to be talking about the internal and external reproductive organs of folks with uteruses, people who menstruate. I've got my mask on today to help protect against COVID. So we're just going to go ahead and get started. Okay, so this fun drawing that we're looking at right here, these are called the internal reproductive organs. So people who are born with these internal reproductive organs, we call them menstruators, right? Because these are the organs inside your body that help you menstruate. So just like how we have like stomachs and hearts and lungs that serve other purposes and functions in our bodies, we have these cool organs, and they're called our reproductive organs. And they're not this big, they don't actually look like this. This is just our drawing so we can learn. But these organs live in our bodies kind of around like the zipper of your jeans. So like lower belly, kind of near between your hips. And we're gonna kind of talk about what happens during puberty and how people have their periods, how people menstruate. It all starts with these little fun circles. These are called ovaries. And everybody has two ovaries. They're about the size of like an almond, so they're pretty darn small. What ovaries do is they hold something called eggs or ovums. And those little eggs hang out in here for most of our lives. We're born with all of the eggs that we're ever gonna have in our lives. And they're super duper duper tiny, right? So we're not talking about like a chicken egg when we talk about eggs. These are so small that like you can barely even see them with your eye. They're just like a little clump of cells, basically. So what happens when somebody starts going through puberty is the hormones in their bodies change. And so eventually our brain is gonna send a message down to our ovaries to start what we call like the menstrual cycle, the menstrual process. And so the first step in that is these ovaries are gonna release just one of these super duper tiny eggs. So one of these eggs is gonna travel out and go up into the fallopian tubes. So you have two fallopian tubes and they connect the ovaries to the other reproductive organs. And that little egg is just gonna travel along this fallopian tube and it's gonna hang out there for a few days. This is where fertilization would occur. So if somebody does become pregnant, if sperm is present in the uterus, which is this big thing we'll talk about in a second, this is where the egg is gonna be fertilized. But most months, most of the time, folks just have periods, right? So we're just gonna kind of focus on that. So that little egg hangs out here in the fallopian tubes, and then it breaks down. So this little egg is already super tiny, and it's gonna dissolve into even smaller pieces. Just kind of like if you ever put a sugar cube in a glass of water, that's kind of how it dissolves and breaks down into little pieces. So those even tinier little particles, they're gonna travel into this part right in here. And this is called the uterus. The uterus is super duper strong and cool. So what the uterus is, it's this big part right here, it's a muscle. It's a really, really strong muscle in our bodies. And while that egg is being released and hanging out in the fallopian tubes, the uterus is like beefing up. It's getting like tissue and blood and nutrients and oxygen inside of these walls here. And that's because just in case that egg becomes fertilized, the uterus is where the egg develops into a fetus and where that fetus would grow and develop. So that's why it kind of gets all of this stuff prepared for it to make a nice, cushy, comfy home for that egg. But once those little tiny particles reach the uterus realizes like, hey, this egg isn't fertilized. I don't need all of these blood and all of these like nutrients and stuff that I've got here for it. So the uterus does something really cool. It contracts. And that's just kind of like how, you know, when we have muscles on our arms, we can like squeeze our muscles and they get kind of bigger and harder. That's what the uterus does. So the uterus like squeezes and contracts and then it relaxes. And what that does is it pushes all of this tissue and blood and little tiny egg particles out because it's like, I don't need these things anymore. So all of that stuff travels through this part, and this is called the cervix. The cervix is really cool. It's the tissue that connects the uterus to the vagina, which we'll talk about in a second. So the cervix is really, really awesome. It kind of looks like a little pink donut almost, and it has a little tiny opening that these egg particles and this blood and tissue can move through to leave the body, to go outside of the body. So it goes down through the cervix and into this part, which is called the vagina. And the vagina is also a muscle. It's kind of like a hollow tube, and it connects the uterus and the cervix to the outside world, basically. So it's kind of like a little hallway, a little passageway that this egg particles and the blood and the tissue and the nutrients travels through to leave our bodies. There's also a little part inside of the vagina called the hymen. And the hymen is just like a very small little bit of tissue right inside the vaginal opening. Some people aren't born with a hymen. It's just like a little extra piece of tissue. Think of it like tissue paper. It's really thin, and it has openings in it already, and that's how blood can travel and pass through it. But different activities like playing sports, using tampons, masturbating, those are gonna kind of stretch and change the hymen. And there aren't really any like blood vessels or nerves inside the hymen. So when it stretches and when it like changes shape and moves, it's not painful, and it's not gonna cause any bleeding. That's a pretty common myth about hymens, is that they like break or they burst or something when someone uses a tampon or when someone has penetrative sex. But that's really not true, because the hymen just changes shape and kind of stretches and moves around inside of our bodies just through like normal activities, like using tampons and stuff. So that is where all of that blood passes through. So we start in the ovaries, and that egg travels to the fallopian tubes, and then the little egg particles go to the uterus, and that's where all of that blood and tissue is stored. And then the uterus contracts and pushes out the blood through the cervix and through the vagina, past the hymen, outside of our bodies. And so that's what happens on the inside when people menstruate. So we just learned about the internal reproductive organs and how they function, and how menstrual cycles and periods happen from the inside of our bodies. And now we're gonna talk about the anatomy of the outside of our bodies. So this is the external reproductive organs on somebody with a uterus. Again, this is just kind of a goofy drawing that we use to like learn. This is not actually what the external reproductive parts look like. So what we're looking at here, if you're a little bit confused, these parts over here are like somebody's thighs, and these down here are the booty cheeks. So that's the part that we're looking at today. This whole area of somebody's body is called a vulva. Not many people know that word. A lot of people call this whole part a vagina, but like we just learned, the vagina is actually an internal organ inside of our bodies. So the external part is called the vulva. This little hole right here is called the vaginal opening. So the vaginal opening is the end part of the vagina. That's the part where like menstrual blood and those like little egg particles leave our bodies. So when somebody like uses a tampon, when somebody uses a pad, this is the opening that fluid comes out from. And then this even smaller opening right up here is called the urethra, or the urinary opening. So just like the vaginal opening leads inside the body to the vagina and the cervix and the uterus, the urinary opening leads inside the body to the bladder. So that's where pee comes from, right? Two very separate openings that lead to different organs inside the body. And then the third opening on the vulva is down here, and this is called the anus. So that opening leads inside to our digestive tract, right? So that's where poop comes out. So we've got three very separate openings. There's the urinary opening on top, the vaginal opening in the middle, and then the anus at the bottom. So there are a few other parts on the vulva that are important to know about. And the first one is the labia. So there are two sets of labia. There's the internal labia and the outer labia. And the labia, they serve the function of like protection, right? So the labia are flaps of skin, and they look different on different people, right? So just like how all of our faces look different, people's vulvas look different too. So the labia vary in like size and shape and color, and that's all totally normal. So the inner labia and the outer labia, they're basically like flaps of skin, kind of like how our eyelids help protect our eyeballs from like dirt and bacteria getting inside our body. That's pretty much the role that the labia play. So the outer ones are along here, and those are gonna be larger. Those are what you're gonna see like if you're looking at a vulva. And then the inner labia are a little bit smaller, and they're on the inside, and they really help protect the vaginal opening and the urinary opening. So just protecting like dirt and bacteria and like all those things from getting inside of our bodies. The other part that people are gonna need to know about on their vulva is called pubic hair. So we know that during puberty, a lot of stuff happens to our body, right? It's not just that we like start having a period. we go through a lot of different changes. And one of those changes is people grow body hair, right? So people of all genders with all different types of reproductive organs, they're gonna grow body hair. And pubic hair can grow different on different folks, right? So sometimes pubic hair grows at the top, up here, kind of above the vulva. Sometimes it grows along the sides of the labia, that's totally normal. Sometimes people might grow pubic hair a little bit out on their thighs even, and that's normal as well. And it can extend all the way down around the anus. So there's all different ways to grow pubic hair. Some people choose to shave or cut their pubic hair, which is a totally valid choice, but you don't have to do that, right? Pubic hair is totally sanitary. There's nothing wrong with having it. And then the other part here on the vulva is called the clitoris. So that's this little dot up here. And it kind of looks like an opening, right? It kind of looks like the urethra or the vaginal opening, but it's actually part of a larger part of our vulva that goes inside of the body. So the clitoris doesn't really have a function. It doesn't really play a role in reproduction or in menstruation. What the clitoris is, it's a collection of really sensitive nerves, and it's basically just like a pleasure center on a vulva. So the tip of the clitoris lives underneath the inner labia, and this is called the clitoral hood. And just like labia, clitoral hoods look different on different people. And then the tip of the clitoris is outside of the body, but it's actually connected to a part of the clitoris that goes inside of people's bodies. And the clitoris goes along either side of the outer labia, and it kind of has legs that go down. And so the clitoris is just a really sensitive part of the body. I'll try and draw it on here like that. Ooh, awesome. So again, just to recap, this is the vulva. The vaginal opening is where period blood and menstruation stuff comes out. The urinary opening is where pee comes from, and then the anus is where poop comes out. And then you have the outer labia, the inner labia, you have pubic hair, and the clitoris and the clitoral hood at the top.